Great. We're just going to go live to start the recording. So great. Welcome everyone to today's talk as part of Mind the Bleeps preparing for FY1 series. My name's Kirsten. I'm currently an academic FY1 in the London Deanery working at St George's Hospital. So today I'm going to be delivering a talk about the ePortfolio, which is actually not too dissimilar to the ePortfolios we do at medical school. So I'm just going to talk through lots of... okay, everyone's saying that it says starting soon. Great, so you should be able to hear now. So yeah, great. We're going to talk through all the different parts of the ePortfolio, what you will use it for, how to fill it in, and which parts are mandatory. Some more main mandatory parts, it's slightly varied trust by trust, but we'll talk through largely what's mandatory. So yeah, let me just share my screen with you. And then we can get going. So if you guys could just let me know if you can see the slideshow and you can hear me. Can everyone see the slides? Just pop it in the chat. And before we get started, I just wanted to advertise that Mind the Bleep are doing a free in-person preparing for FY1 series. If you look on our website for more details, that are running across weekends in July. And this is kind of like a crash course, weekend full day course for free, which is amazing, that other junior doctors will teach you the top tips and tricks with getting started and kind of do lots of in-person simulation scenarios to practice being the F1 on call before starting the job. And there's also a giveaway of the FY1 swag bag. So I'll put all the details of that in the chat afterwards as well. So yeah, as I said, today is going to be a talk about the ePortfolio. So what is the ePortfolio? So I'm a doctor in London, so we use the Horus ePortfolio, and I believe that's the same case for the rest of England. And if you study in Scotland, Northern Ireland or Wales, it's a very similar concept, but a different program called TURAS. And just like in medical school, we use it to log things that we've done on the wards. So record clinical competencies that you've developed. So when you've achieved something and you've developed clinically, whether that be better history taking or you've learned how to do a procedure, and you can log that in your ePortfolio. You can log learning opportunities you've been to, so whether that's clinical or non-clinical. So if you've gone to a clinic to shadow, you can log that, or if you've run your own clinic, you can log that, or if you attended teaching sessions as well. Reflections, so as part of being a doctor, reflecting on your own practice, things that went well, things that didn't well, and how to improve as a clinician. And then just your general progress. So I'll go through all the different forms you can fill in Horus ePortfolio to give you a flavour of what kind of things you can write about. And why do we bother putting together an ePortfolio? It's basically the foundation school's way of seeing what we've been up to throughout the year, which is difficult because they can't kind of closely follow each one of us. So it's up to us to kind of provide a kind of a written log about what we've been up to in the year and how we've developed from the start of F1 to the end of F1, because trust me, you'll learn a lot along the way and you'll be exposed to a lot along the way as well. So at the end of F1, you have your ARCP, which is your annual review of your clinical progress and competencies. And this is where a panel of people, so usually your training program director and two other people, sit down and kind of look through your portfolio to check that you meet all the requirements and you've had good progression throughout the year. That means you can pass and go to F2. So it's really important that you keep your ePortfolio at the back of your mind, because there's a deadline for when it has to be submitted. So if you just keep thinking about it and keep chipping away at it, that would be my best advice. So in terms of what you need to do for each placement, is the best way to think about it is, so everyone has a clinical supervisor and everyone has an educational supervisor. So your clinical supervisor is usually a consultant who works in the rotation that you're going through. So, for example, my first rotation was a respiratory job. So my clinical supervisor was one of the respiratory consultants. And your educational supervisor typically will be whoever your clinical supervisor is on your first block, and they'll stay on for the rest of the year. So my respiratory consultant is also my educational supervisor, although as I've rotated through my next two jobs, I've had different clinical supervisors. So for each placement you go on, you need to meet with your supervisors at the beginning and at the end of the placement. And that helps you set out your goals for the placement, what you want to achieve. Also, especially with the clinical supervisor, can help you voice anything you'd like to learn from that specialty or any opportunities you'd like to gain, and they can help tailor your experience towards that. And then you meet at the end of the placement to see how you've progressed, what you've learned, and to bring up is a good opportunity to bring up any issues that you've experienced throughout the placement, especially with your educational supervisor who's there for also a pastoral role. So within the beginning meeting, you'll discuss what's called a personal development plan. So this is a form you fill in at the beginning of each placement on Horus that details what you would like to achieve. And you can break that down into lots of different things. So in my personal development plans, I wrote about what clinical competencies I wanted to achieve and what knowledge competencies I wanted to achieve. And then also I wrote some personal plans, development plans as well, and some career plans as well. So it doesn't have to be all completely healthcare. So my personal plans were to do more regular gym classes and to dance more and to take regular lunch breaks to make sure I go outside of the office for that. And then my more clinical based goals would be, for example, be confident interpreting chest x-rays and start to look at CT scans and discuss it with seniors, or just improve my approach to ask to see the patient approach. So my A to E formula. So yeah, it's really flexible and it's just there so that you have something to go off with your supervisors and they can kind of see that you've worked towards some goals. And then at the end of the placement, you have what's called a summary narrative, where you write a short paragraph about what you've learned that placement and how it maps to the curriculum. So I'll show you that in a bit. And then just like in medical school, you have like mini KEXs and DOPS and case-based discussions. It's recommended you do at least 4 of these in each placement. There's no specific number that you have to do and dependent on the trust. So I would recommend doing 4 supervised learning events, which I will talk about in more detail. So this is just a screenshot from the website that kind of details these mandatory forms. Just to note that these forms in the middle aren't necessarily mandatory. So for example, for my trust, I just had to do 4 SLEs. It didn't have to be every single one. So things like learn and leader and teaching were all optional. We were focused mainly on the top 3. So these are the meeting forms which your supervisor will fill out. So where it says FD is what you guys have to do. So you have to write in your personal development plan for each placement and fill out your learning log, which I'll tell you about, and your SLEs. And then you just have to arrange a meeting with your supervisor so they can do that part. So across the year, what do you need to do? So you need to do a TAB, which is a team assessment of behaviour. So what this is requesting feedback from your team members. So these can be other junior doctors, more senior doctors, and other allied healthcare professionals such as pharmacists, physicians associates, physiotherapists, and nurses. And you send out the TAB, so you pick who should give feedback to you. And you need to reach a certain number. I believe it's a minimum of 10 respondents and have good spread across the different healthcare professions. And then a PSG is basically the same thing, but your supervisor picks who the feedback is sent to. So there'll be at least 1 consultant and then 2 other healthcare workers. So tab is chosen by you and your PSG is chosen by your supervisor. And you have to complete one minimum across the year. So I would recommend doing both your tab and your PSG in your first block, so that if there are any issues with that, then you have the opportunity to do another one in your second block. Other things to do across the year is write some reflections. So this is actually a lot easier than it sounds. So you'll come across a lot of interesting cases or discussions, clinical decision making, or some quite emotional, communicative moments throughout the year. And often your seniors might suggest you write a reflection on this. And that's a nice prompt for you to open your ePortfolio and just write a short paragraph about the situation, keeping it anonymous, what you learned from it, and how you'll take the lessons moving forward to improve yourself as a clinician. So I would aim to do about one reflection per block. Other things to do is to upload your PSA certificate from medical school. You should have completed that by now. And then the next thing is you have to get involved in some kind of quality improvement project and upload evidence. That can just be like a letter from your supervisor or just some evidence of the data that you've collected. So again, I would recommend starting this in your first block. Just ask your senior colleagues or team up with other F1s to try put together an audit. Ideas in terms of ideas for audits, it can be as you go through your first block, what kind of clinical problems do you think are missing or aren't quite, what kind of guidelines aren't really stuck to? Can you audit if that's what happens in practice, or bits of your practice that you think you want to change? So yeah, speak to your seniors. They might have ideas as well, and just get going with designing an audit and beginning data collection. So you just need to upload some evidence of that for your portfolio. And then you have to do a Form R, which you complete at the end of the year, so you don't need to worry about that for now. And then your personal learning log. So as part of the F1 course, you would typically have weekly teaching, which is, for example, every weekday lunchtime. So ours is every Tuesday afternoon. We have 1 hour of teaching. And then twice per rotation, we have a full day of teaching. That's 8 hours long. And we get study leave for that. So I would log every teaching event you attend, whether that's in hospital or out of hospital. So what counts as core is any educational event that is advertised to the whole F1 cohort, is the easiest way to think about it. So this would include your weekly F1 cohort teaching, your F1 full day teaching. As I've said, you usually have to do mandatory simulation training, prescribing training, and online e-modules that are mandatory for the whole year group to do. And then things that are non-core is stuff like this. So if you've attended a teaching session outside of your hospital, well, it can be in hospital. So if you attend a teaching that's not in the hospital, not run by the hospital or the foundation school, then that's obviously non-core. So that can be seminars, conferences, things like that, or webinars like Mind the Bleep. Or it can also be in hospital, but it's not intended for the whole year group. So for example, on respiratory, every Wednesday morning, we have departmental teaching. So it's just for respiratory trainees and people working in that department. So that counts as non-core. And it sounds like a lot of hours, but it quite easily racks up. So for example, a teaching day is 8 hours, and there are 6 teaching days across the whole year. So it's very easy to add it all up. So yeah, this is just another screenshot from the website as well. So bits that you have to do are the PSA, the tab, QI, some reflections, and then your supervisor will do an end of year report for you, and then you'll do your Form R. So going back to the supervised learning events, which will probably be the bulk of your portfolio. So DOPS is a direct observation of a procedural skill. So you can just ask an F2 or above to watch you and give feedback on a procedure that you've learned and feel confident doing on a patient. So that can be an ECG, a cannula, taking bloods, an ABG, and more complex things if you feel confident, like LPs. And then mini KEXs, it's like a clinical evaluation exercise. So again, it's when you've done something clinically on the ward or on take, and it's been observed, you can get a SHO to give you feedback and pointers to improve. So, for example, I would ask for a mini KEX on either like I've taken a history or I've examined a patient, ward round documentation, clerking patients on take, communication-based ones such as calling a relative, or it can even be like more logistical stuff. So, for example, a mini KEX on arranging a CT scan and vetting it, or ordering a blood transfusion and consenting a patient. And then finally, there's the case-based discussion, which is the most involved. So this has to be signed off by a registrar or above. And I think the easiest way to get this done is if you're on take as an F1, you'll have to discuss the patient you've clerked with a reg anyway. So that would include presenting your history and examination, discussing differentials, drawing up an initial management plan. And you'll be doing all of this anyway on paper and discussing it with your reg. So you might as well ask your reg if you can send them a CBD for an interesting patient. But if you don't have an on-call, you can do this on the ward. So, for example, if the nurse asks you to go review a patient who they're concerned about on the ward, you will also have to feed that back to your ward reg and ask for some advice. So that's a good opportunity to do a CBD. And honestly, it's not too difficult to get them done. People are very understanding that we have to do these. They're quite happy to kind of get involved with a bit of teaching and signing you off. And I would kind of think every 2 weeks or so, just think about doing one. Just so, probably don't need to do that many, but it's just so that it's on your mind and you don't kind of rush to do this all at the end of your placement. And there's also other types of SLE forms which you can come across on Horus, which, to be honest, I didn't use myself personally, but you've got your learn form, your what does it stand for? Developing the clinical teacher form, and your leader form. So learn is just about a learning encounter and writing a note, reflecting on it. Leader is when you've shown some clinical leadership, you can ask someone to write a more thorough assessment feedback. So it's about leadership, acting in teams, enabling improvement and reflections. And then DCT is if you've delivered a teaching session, whether that's on the ward to medical students or it's doing some online teaching like this, for example, then you can just get that signed off as well and put it on your ePortfolio, something that you've done. So hopefully that's all clear. This is probably the most important bit of the portfolio because it forms the bulk of your portfolio. Has anyone got any questions so far? Nope. Cool. So I'll just carry on. Who can sign off the SLEs? So DOPS can be an F2 or above. Mini KEX has to be an ST1 or above, so an SHO that's not an F2. And then case-based discussion has to be a ST3 and above, so a registrar. So other kind of forms you can upload just to bulk out your portfolio is exams. I've got another question on average. How many DOPS or KEXs do you need per rotation? So I would say you need about 4 SLEs per rotation. And there's no minimum number at my trust, and I don't think anywhere else. So roughly about 4, and it can be any of these. So additional achievements you can add on. So if you've passed your ALS course, it's not mandatory, but it's really useful to have. And then you can upload that onto your portfolio if you've attended any courses or seminars. Interesting cases you've come across on the ward that you just want to write down as a log. Any research publications you've been involved in, any taster weeks that you've done, and any kind of more informal evidence of teaching. So if you've got some feedback forms from some teaching sessions you've done. And those tend to be not mandatory, they're just kind of added bonuses. So yeah, these are some of the optional forms that you can put down, just a screenshot from the website. So looking at the FD section here, as I've said, courses, exams, achievements, procedures as well, but you might as well put it as a DOPS if you can get it signed off. Research, reflections, tasters, teaching. Then you can also write about your career planning. So there's space to write about what you think where you think your career might be heading. If you've got any ideas of what specialties you want to choose, you can just write down what you're interested in and how you're working towards that. So I talked about Form R, which is a form you do at the end of your portfolio before you submit it to the ARCP panel. So you basically just confirm the rotations that you've had, and then the most significant part of it, or the reason why we do it, is to make sure we detail any issues that have come up across the year. So we write down any sick leave that we've had, whether that's sickness leave or maternity leave, paternity leave, and industrial action. So it's called time out of training. So the days that we've taken time out of across the year. And usually they advise you keep this as under 20, otherwise it will trigger a more detailed review of your portfolio. So this includes industrial action and striking as time out of training. So just something to bear in mind. You also write down any significant events you might have been in. So for example, if people have raised investigations regarding your clinical practice, you write them down in your Form R, but make sure you discuss this with your educational supervisor of how you should detail this and whether or not it's resolved. And you can also write down if there's been any other complaints or investigations into your practice. But otherwise, you can also write, in a more positive note, some compliments that you've received throughout the year, because sometimes you get verbal feedback from other doctors or other healthcare workers or patients and families, and it's obviously not on paper, which the ARCP panel can't see. So this is a good time to write it. So yeah, basically it's just to make sure that you've declared your time out of training and if you've been in any significant incidents or not, which typically most people haven't. But it's just to bear in mind, if you do find yourself in one, you have to declare it on your Form R. So I've talked a lot about different forms in the ePortfolio that you have to fill out. And what you have to do across the year is map them to the curriculum. So the curriculum comes in three learning objectives, and it breaks it down into smaller objectives. So what you can do is tag or map your form, so one SLE, for example, or one mini KEX, to three different curriculum points. So for example, if I clerked a patient on the acute medical take, I would tag it to clinical assessment, clinical prioritization, and also continuity of care, so working out of hours. Or you can say if I did an audit, I would tag it to quality improvement and sharing the vision, so working with other medical team members to conduct the audit. And I would also tag it to continuing professional development, so making sure I develop myself as a clinician. So it's very easy to map your SLEs because a lot of what you do day to day fits into a lot of these values. So it's just something worth thinking about as you go along. Make sure you tag SLEs to at least each curriculum point. And you should ideally have 2 or 3 maps on each curriculum point. So someone's asked, how do you keep on top of tagging / mapping everything? So I'll show you in a minute. I'll share my screen to show you my portfolio, but it's really easy. You just click map to curriculum and then you tick 3 bits that you want to map. And then when you click onto your curriculum, you can see how much you've tagged already and which ones need more tagging, which curriculum points you haven't addressed, and then you can write reflections or think about how you might improve that in your clinical practice. And then, as you can see at the top, there's the curriculum summary narrative. So at the end of each block, I just write a few sentences about how I think I've achieved these 5 curriculum goals. And I kind of relate it to the SLEs I've tagged into it. So I'll say, for example, when I organised that blood transfusion, I learned how to prioritise clinically and initiate urgent treatment. Yeah, it's quite self-explanatory. And yes, it is mandatory to map everything. It just shows the panel that you've understood the whole curriculum and that you've got evidence that you've met this curriculum. HLO2 is sharing the vision, fitness for practice, upholding values, quality improvement, and teaching the teacher. So lots of things you can do with those additional forms. Someone's asked, so can I confirm, is it roughly 2 to 3 SLEs for each curriculum point? Ideally, yes. As I said, there's no minimum amount of SLEs, and you can tag one SLE to a maximum of 3 curriculum points. So yeah, it's not 1 per curriculum point, if that makes sense. You can spread them across. And then HLO3 is the professional responsible for their own practice and portfolio development. So ethics and law, demonstrating professional practice, continuing professional development, and understanding medicine. So a bit of career planning. Good. So that's pretty much everything. So top tips, how can I get this all done? Just be really proactive. You will have assigned supervisors, but you need to reach out to them. They might not email you. So you need to email them at the beginning of each block and at the end of each block to find dates and times for your meetings. You'll both be really busy, so try and find a date ahead of time. Just allow about half an hour for a meeting. As I said, get your tab and PSG and your audit done as early as you can in your first rotation is ideal, whilst you still have the energy and it's at the front of your mind. And then lastly, I would ask for SLEs. Sometimes the ward can be really busy and your seniors might not remember that you need to achieve all these competencies on your portfolio. So just ask, and almost always the answer is yes. So think about who can do your sign-offs and ask them. Just say, if you've got a quiet afternoon, can we do a case-based discussion, or volunteer to clerk a patient if they're coming onto the ward, or if you're on take, and then ask if you can also do a CBD or a mini KEX for that. So just ask is my top tip. Don't be shy. Map to the curriculum as you go along. Once your SLEs are uploaded onto the portfolio, you can map them. And just remember to log everything, especially with teaching, because it really does add up and you can achieve the 60 hours goal. So everything you attend, just make sure you log in quickly on your phone and just log it. Good. So those are all my tips. I think if people have questions, please put them in the chat about what I've discussed so far. That's pretty much all the information I wanted to share with you in terms of what the ePortfolio is and the different forms. I'm just going to share my screen to show you what the ePortfolio website actually looks like and to show you my portfolio. But as I do this, please feel free to put any questions that you have into the chat. Hopefully it's all been quite self-explanatory. So I'm just sharing my screen with you now. Can everybody see my web page? Can everyone see the screen? Yes. Okay, perfect. So this is what Horus looks like if I go to the home page. Yeah, so it will show you signed forms that you're waiting on to sign. That's fine. So I would go on to portfolio, would open it. So overview. This just shows your details. And then if I just go onto the contents, this just shows you the forms that I've done throughout the year. So, and it's grouped by rotation. So rotation 1, rotation 2, rotation 3. And as you can see, it's quite easy to kind of accumulate lots of different forms, which is good. So, for example, if I just show you my personal development plan, these are the kind of things that you can write. So I split my specific goals into clinical, career, and personal. So what development goals do I have? How will I address these? And how will I evaluate whether I've done it? So what proof or evidence can I provide? And this is just useful for your supervisor to keep track of your progress. And then if I just show you guys what an SLE looks like. So, for example, this is a DOPS. So you just write down what procedure you've done, how you can record just a brief description, where you've done it, and then feedback from your trainer or feedback from the doctor that's agreed to sign you off. And then you can write a quick reflection just to see what you've learned from learning that procedure. And then you just fill in the details of who's agreed to sign you off at the end. So then for the mapping bit, that's the part I wanted to show you. On the right-hand side, you have this button called Map to Curriculum. So you just press that, and then you can see for this one, I've mapped it to HLO 1.2, so clinical prioritization and continuity of care out of hours. Haven't mapped to anything in HLO 2 or HLO 3. So I've done 2, but I could have really mapped it to 3 different things if I wanted to. So that's all the forms. And then in terms of looking at the curriculum, you can open that and then you can see your mapped evidence. So I've mapped 6 different things to this curriculum point throughout the year. And you can just see as you go along, it's very easy to map stuff to each curriculum point because you can map up to 3 curriculum points per form. And then when you see a yellow sign like this, it means that it hasn't actually been signed off. So unfortunately, it won't have counted towards my portfolio because the doctor who I sent the form to hasn't signed it off yet. So yeah, it just maps as such. It's quite self-explanatory. And then these are your summary narratives. So yeah, for example, this is just a short paragraph where I've written a few sentences per placement to try and explain how I've addressed the curriculum points below. So yeah, hopefully that all makes sense. I think that's everything I wanted to show you. Oh, I'll just show you the personal learning log quickly. This is where you can log the number of hours of learning you've done. So for example, just non-core and core. So these are all my pediatric department teaching teaching sessions each week, and then this is my core simulation kind of. St. George's ran a F1 simulation course for us all, and that's core because it's advertised to the whole course and it's mandatory. So yeah, that's pretty much it in terms of the portfolio. So I've got a few questions. Can study leave count towards the 60-hour teaching time? So in F1, you actually don't have any study leave. You have what's called personal development time. Sorry, I think I used the phrase study leave in terms of the F1 teaching days. I'm sorry if that's confusing. Basically, F1 teaching days are granted, so you should be released from your clinical duties, and that's just a paid day to go and do teaching. So you'd be paid like you would be had you gone to work, but you go to a teaching day instead. So you don't actually have any formal study days, which you do in F2. But what you can do is bring forward 5 study leave days into F1 for a taste a week. So you can take a week away from your clinical work, or 5 days technically, to go to a different department, which is actually what I'm doing now. So I've taken a week off my pediatric job to go to ICU for a taste a week, which is just useful to help career planning. And then people get a bit confused about study leave because we have what's called personal development days, and this varies at each trust or each hospital, but you get a certain amount of time, whether that's a couple of hours a week or a day a month or a day every 2 months, and that's called personal development days, and that's for you to work on your own projects. So it gives you time to do your quality improvement projects, any audits you're working on, any research you might be involved in, and that's basically a day where you can work from home and get the admin stuff done and to do some of your own personal work. The BMA said F1s are entitled to 15 days of study leave. I'm not sure about that. I think that might be F2. We definitely don't get any official study leave, for example, for exam revision or conferences and stuff. Can all be a bit complex because I think that might have included some websites include study leave as your teaching days and your personal development days, but that is separate. Study leave in F2 is when you have like exam revision or you want to go to a particular course or webinar or you've booked onto a conference and you have to ask specifically and give a reason why you want that day off. Has anyone got any other questions about the ePortfolio stuff? Otherwise, if there's no more questions, I'm just going to reshare my screen with everybody. So yeah, thank you all so much for coming to today's talk. I'm just going to share the feedback QR code. I'd really appreciate if you guys could leave me some feedback about if today's session was useful or not. And please do reach out to finalyear@mindthebleep.com if you have any questions. Oh, sorry, I missed a question. Will the session be uploaded and have previous ones been uploaded for the 2024 series onto YouTube? So yes, this session will be recorded and uploaded onto Medall. And then once the series is complete, we will upload all of the recordings onto our YouTube channel. Great. Well, thank you all so much for joining today. I hope you found that useful. The ePortfolio shouldn't be a daunting thing. It's just something to have in the back of your mind as you approach and start F1, because I know it can be really overwhelming at the beginning. There's lots of new changes and meeting new teams, but it's just worth thinking, starting this early so that it doesn't overwhelm you when it comes to the end. Just because also, one thing I forgot to say, to bear in mind, is that your ARCP falls halfway through your third rotation. So you have half the time in your third block to complete all the different SLEs and reflections. So it's just worth getting ahead of yourself. Someone said that they've joined on a phone, so they can't leave feedback. So I'm just going to find the feedback link and I can post a link in the chat and you can leave feedback that way. So I'll just find the link for you. Great, so I've just sent the feedback form in the chat. So if you guys can't scan the QR code, then you can go via the chat. Okay, well, thank you all so much again. Please do leave feedback. It would be really useful for us. And we hope to see you next week at our prescribing session as a continuation of our preparing for the FY1 series. So yeah, it was really great for you all to join today, and thank you for taking the time this evening to join me today. So yeah, I'm going to leave it there. Thank you very much and have a good evening.